All right. I think all of our panelists are here today. You guys want me standing or sitting? Does it matter? Okay. All right. Yeah, come on up. Hi, everyone. Thank you for joining our panel today. Impact of coronavirus on a vulnerable population. My name is Elliot Kreitenberg. I'm the co-founder and president of Dimer UV Innovations, and I will be your moderator for this session. If you guys don't know Dimer, we're best known for an infection prevention, especially international infection prevention, for our work on the Germ Falcon, which was since licensed by Honeywell and is now the Honeywell UV treatment system. Dimer's newest products are designed for healthcare environments, and Dimer is leading the healthcare industry. Our products have been deployed in planes, hospitals, hotels, schools, behavioral health facilities, professional and collegiate sports, commercial and government buildings, factories, assembly plants, and more. I'm really excited about this panel because as an infection preventionist, this is a topic that's really important to me, and I would consider myself an expert. But our panelists work with some unique groups of patients and facilities, and I'm hoping that we'll get some insights from the panel that you can take home and put into practice. Our panelists today are Vincent Frank, COO of West Valley Detox, Tracy Lamb, CEO and founder of Smart Caregiving. No, she's not up here. Not up here? All right. Mark Edwards, co-founder and CEO of ViewMind. That's you? All right, Mark, nice to see you. Rebecca Eyre, okay, CEO of Project Heal, and Many Admony, who I don't think is here either. All right, but I think we do have a really great panel for you today. I hope I do it justice as the moderator. And if I say anything or make a joke that offends you, please wait till the end to come up and slap me, as we're tight for time. With that, we'll go left to right, and I will let Mark start by introducing himself, and we'll go from there.
If all of our panelists aren't here, you should just come sit with us.
Should we wait? Should I riff a little bit? Work on some new material? Okay. How much time do we want to give them? 2 minutes? Okay. All right, so we'll take a little bit of time for introductions. I think the four of us should take advantage of the time that we have between us. So I introduced myself a little bit, co-founded the company with my dad in 2012. Nobody was really taking infection prevention all that seriously. You know, a little spike in 2014 with Ebola. SARS and MERS were kind of before we started, but coronavirus really put us on the map. You'll hopefully be flying one of these planes that's been disinfected with our equipment on your flight home today or tomorrow. That's enough of me. Mark, why don't you take a minute and tell us what you do?
Yeah, hi, I'm Mark Edwards. I'm the CEO and co-founder of ViewMind. ViewMind is a company that has developed digital biomarkers for diagnosing brain health. And I gave a presentation yesterday just to provide more background in this area, but brain health is, obviously our brain is a very important organ, maybe our most important organ, and the technology that is available today to look at brain health is really only used when there are symptoms. So things like pen and paper testing for looking at cognition, like a mini-mental, Adams-Brook, these kinds of tests. And then you have other kinds of biomarkers like a PET scan or a lumbar puncture looking for proteins in the body that are characteristic of things like Alzheimer's. And then also neuroimaging is another area. So a lot of these tests are invasive, they're expensive, they're only performed when there are already symptoms. So ViewMind's approach is to use the eye as a point of access to the brain. The eye is anatomically part of the brain, and we're able to stimulate various different regions of the brain with visual stimulus through a headset. We can then activate a certain area of the brain. We can capture the eye movement responses, and we feed all of that data that we capture in a relatively short test that could take 10 or 15 minutes into an artificial intelligent system that correlates the patient's data with particular pathologies. So really our positioning is around evidence-based disease management, neurological disease management. That's really where we want to be focused. Because today a lot of treatment for central nervous system complaints is very much subjective. A doctor will try something and maybe adjust based on how they respond. So we're trying to provide much more objective data to be able to manage this process. One of the areas that we have worked in is COVID. And obviously, I suppose the biggest concern about COVID has been the mortality concerns. But a huge number of people are affected by long COVID. And in fact, there was a big study that was commissioned by The Lancet of 234,000 people. And it showed that 6 months after recovery, 33.6% had neurological issues. And we have done a clinical study to analyze individuals who've recovered from COVID, and the results are really quite concerning, that the ability of an individual to process information and perform complex tasks is impaired and degraded by about 50% based on our study results. And some of the things that we're finding out are that part of what happens with COVID is that people get a neuroinflammation, so inflammation of brain tissue. And this is similar to the pathogenesis of Alzheimer's, where you get inflammation in areas of the brain. Now, I'm not necessarily joining the dots and saying that we're going to have a huge spike in Alzheimer's, but there is that risk, and there is a concern about the consequences of long COVID. So that really is my particular interest, I guess, on this panel is about the long COVID. And we have just been commissioned by the government of Luxembourg to conduct a large study with the Luxembourg Institute of Health to study this particular phenomenon.
That's great.
So,
Rebecca, go ahead.
My name's Rebecca Eyre. I'm the CEO of Project HEAL, which is a national nonprofit that's focused on creating equitable access to eating disorder treatment. People with eating disorders have been extremely affected by the pandemic, and so when I saw the name of this panel, I thought it was really important to make sure that we're talking about not only mental health more broadly, but specifically eating disorders. Eating disorder hospitalizations doubled during the time of the pandemic, and they're one of the most common and most fatal mental illnesses, and they're very often not discussed in settings like this in broader health conversations, and sometimes even in broader mental health conversations. There's a lot of stigma around it, a lot of hiddenness, and the isolation of the stay-at-home orders only exacerbated that. So I'm very pleased to be on this panel and grateful for the opportunity.
My name is Vincent Franke. I'm the COO at West Valley Detox Treatment. I'm also excited to be on this panel. The whole COVID thing has been a whirlwind for many of us. I come from a small town in California called Los Angeles, and millions of us have been set aside, stayed at home, and I know what it's like to spend 2 hours on the road to go 12 miles. I also know what it's like, to go 10 minutes on the road to go the same 12 miles during COVID when no one's around, and it's eerie. And so I've been working every day since COVID started. I also work with a very marginalized community. 40% of my clients have either been unable to access care because of lack of finances, so social economical situations arise, and so they haven't had health care, and getting people care when they need it, especially for detox, substance abuse, mental health, dual diagnosis, when they need it is a very small window. So being a part of this panel is an opportunity to talk about that and share the space. Thank you.
Yeah, Vincent, thank you. Why don't we snake back for this next question? So you each talked a little bit about the vulnerable populations that you work with, but how specifically was the COVID-19 pandemic, relevant within kind of the worlds that you work in?
For me, my population, largely I work with a lot of youth, young youth. Let me start, I'm a little nervous, it takes me a minute to warm up. Young adults who have failed to launch seem to be that's probably our primary group. And then the next part is LGBTQ+, a lot of trans people who come in who need services. And again, many of them don't have financial we do hardships. We're private for-profit, and so meeting people and getting people into care is already difficult. And then, starting that therapeutic alliance in that space when people are not trusting the community, trusting their government, and have been set aside for so long, it's an opportunity to be really authentic, which many of us are COVID has put a lot of people in positions of fear, you know what I mean? And so reaching someone who's in fear and just being able to connect on any level is very real. And so for a person like me who, 17 years ago I started in this recovery field, entered into this conversation, I wasn't sure about my footing or my voice. The pandemic has, the last 2-3 years of, working every day through this has really taken, those opportunities and reinforced some of the work that we get to do, because it's been easier for me to track the data. Where pre-COVID, I haven't been able to track the data as much.
Yeah, so I want to just pause and do a little exercise. If you could just close your eyes and picture someone with an eating disorder for a minute. My guess is that most of you pictured the same thing, the most common sort of stereotypical image of a young, white, probably straight, probably cis, affluent white girl. Probably underweight, probably struggling with anorexia. This is the image we've seen over and over and over again in popular media. They're most common stories to be told, and they're honestly the ones that we think we can sort of see. Unfortunately, that is really actually the minority of people with eating disorders. And so I just want to break down a couple of statistics so that you understand then how the pandemic has uniquely affected people with eating disorders. So less than 6% of people with eating disorders are medically underweight. So that means that 94% of people with eating disorders wouldn't look sick according to that stereotype. Black and brown communities are actually more likely to struggle with bulimic or binge eating disorder behaviors. People who are transgender or gender nonconforming are 8 times more likely to struggle with eating disorders than their cisgender counterparts. There's a lot of misconceptions around who has eating disorders and what they look like. Binge eating disorder is actually more common than anorexia and bulimia combined. And so when we think about who is struggling with eating disorders, and then we understand some of the statistics around the pandemic. So like I mentioned, the pandemic really affected people with eating disorders in some specific ways. Not only did most people with eating disorders report increased anxiety and increased depression because of the stay-at-home orders and general anxiety around the unknowns, especially in the first year and a half of the pandemic when so much was uncertain. Their behaviors increased, right? So their eating disorders became more severe. Some folks who maybe had predisposing kind of temperaments had an eating disorder onset that might not have onset in a different context, right? They may have had other protective factors like a community and a structure and a life that they wanted to live, but being stuck at home on lockdown triggered that eating disorder. And some folks who had been in recovery from an eating disorder relapsed, some of whom had been recovered from an eating disorder for 1, 2, 3 decades, right? And so we have overall increase in incidence, and then you have a lot of people losing their jobs, a lot of people losing their insurance. And eating disorders are extremely complicated to treat, and they're extremely expensive to treat, right? The average eating disorder treatment episode is $80,000, and most insurance plans, contrary to popular belief, don't cover this, even though it's against the Federal Parity Act to deny care for mental health coverage. And so 80 to 90% of people with eating disorders before the pandemic weren't able to access treatment because of the prohibitive costs and lack of insurance coverage. With the loss of insurance, the increased stress, the increased behaviors, the increased incidents, we were basically confronted with a crisis. And so Project HEAL has been focused on treatment access for a really long time, since 2008. And so we're really the only organization in the country that people can turn to when their insurance says no over and over again, when they simply do not have a line of credit that can afford the treatment that they need in order to heal. When all of the treatment providers in their network or in their region are out of network with their insurance, we're the only place that they can come to. And so we got a huge influx of folks who had increased barriers to accessing mental health care. And they were in higher acuity than they had ever been, and they were in more kind of emotional distress. And so those barriers to accessing support were harder than ever. So it's definitely affected eating disorders. I'm sure some of you have heard about the youth mental health crisis, and like the US Surgeon General declared that in the US. And the fact that we're all locked inside and on social media more than ever did not help, especially with all these visual platforms of people who are comparing their bodies and using filters and all of these things. Like, our youth are very vulnerable, especially. Also, eating disorders affect people across ages, and so, but the youth is the most vulnerable because that's when eating disorders typically onset, right? And so when we think about early detection and prevention, we need to protect our youth, and that the pandemic made it really hard for us to do that.
So one of the things that we started to really be concerned about is, through the pandemic, is that just the impact that COVID could have on vulnerable communities in terms of dementia. So dementia rates are on the rise. I mean, there are 50 million people, or just under 50 million people in the world today who have Alzheimer's. And by the year 2050, that is going to increase to 152 million. And so there's a huge increase. Partly it's because of an aging population, but there's many other factors that maybe we don't completely understand, which are also influencing the escalation. So we started studying individuals who hadn't been hospitalized but had COVID, had recovered, and then looking at them some while later, 6 months further down the line, and you're finding that there are significant impairments that they were continuing to experience at that time. And that certainly raises a lot of concerns and questions about, is this going to be a catalyst for escalating dementia rates even beyond what was already projected and forecast even before the COVID crisis started. So we think this is an area that really needs to be better understood, and ideally we're also looking at potential digital therapeutic methods that could help to restore certain cognitive domains that are impaired as a result of a long COVID. So that's been our focus.
Great, thank you all for that. And as an infection preventionist whose work has really been in commercial aviation and hospitals, we're really thinking about the general flying public who may not be more vulnerable than easily agitated when you're traveling, but immunocompromised people not only in hospitals but also on airplanes are groups that are particularly vulnerable. But it sounds like the groups that the three of you guys just talked about are all dealing with all these other things, and when you're asking them to take these precautions, wear masks, take these extra personal hygiene, it just adds stress and anxiety to the things that they're already dealing with. My position has always been, it's not the responsibility of the passenger on an airplane to make sure that the aircraft is sterile or hygienic or disinfected to some baseline, but in a restaurant they have these letter grades that require these places to maintain some baseline hygiene, and I generally think that infrastructural infection prevention steps are what have shown to be extremely effective historically, and you're not necessarily asking the individual to do that, but from your guys' perspective, what practices might you have put into place with the communities that you're dealing with that may have worked or not worked, and maybe we can give the audience here something that they can take home and maybe install that could prevent the next infection from having a big impact?
I can kick it off and just say, I think the most amazing thing to come out of the pandemic that's really helped people struggling with mental health has been telehealth. The accessibility factor of being able to simply have access to the internet and be able to find support and not have to leave your house and to be able to stay safe from this very airborne illness has been really, really significant. So now, does every patient love telehealth? No, right? Sometimes there's technical difficulties. Sometimes it's like really obnoxious to see your own photo looking back at you while you're talking about trauma or when you're talking about body image. For people who are dealing with monitoring their weight or needing to deal with that, being forced to weigh yourself instead of having a doctor do it at home has been really upsetting. But the fact of the matter is that there are way too few eating disorder specialists in this country, and they're pretty much centrally located in major urban areas, and people everywhere have eating disorders. And so there aren't states across the country that don't have any eating disorder treatment available, and very, very few eating disorder providers. And so to unlock the ability for those patients to access those providers has been remarkable. Now, we still have some issues around like the rigidity of state licensure. So, you know, some states have gotten together to collaborate around interstate agreements and being able to work with clients in different locales, and basically recognizing each other's licenses, which has helped. But I know that insurance companies are pushing back on that, and there's definitely some issues around, is this still the same, you know, financial value of care? Do we reimburse at the same rates? You know, when is the pandemic over, and when do those telehealth coverage laws get taken away from us, which will really impact people who live in rural environments. But for right now, it's actually opened up a lot of accessibility for mental health care, and it's been really, really helpful.
For us in the inpatient detox setting, we've utilized, we've triaged more than anything, because the city of Los Angeles continues to change, you know, what it requires, and we've morphed with that. We've gone from practicing all the universal precautions. We've had, we've utilized a whole bunch of different providers in the community that will come to the house, meet the client. We've closed off parts of we've segregated, just this room is for quarantine, if they come, if the house, we've dealt with so many different providers in the community where we've been really fortunate and blessed even not to have had COVID enter into our business or place, from setting up universal precautions and monitors and temperature readings and, everything from step in, verifying with another staff, that way everything's observed, dual controls on everything, daily testing with the clients, and then taking in a lot of clients or providers from other places where their places have, their businesses have been interrupted by COVID. And so I think more than anything, the last 3 years, again, being an essential daily worker, I've been really fortunate not to have my place of business, really interrupted in terms of service. More than that, we've been able to help foster care to the other providers in the community. So it's been a wild ride.
Yeah, I guess maybe it's a slightly different situation for us. I mean, our technology does actually have to go on somebody's head, and so we are reliant on a neurologist conducting a meeting with a patient. So in some respects, that obviously that process is still continued. There was a bit of I'm sure in many different areas of healthcare, there was a bit of a hiatus for a while, especially during the early part of the pandemic, where a lot of elective procedures were just deferred, and people were not going in and having some interventional cardiology procedure that was required, or various other procedures, and so a lot of that sort of got delayed. It feels like things have now restored back more or less to how it was, how things were beforehand, obviously with the additional precautions that are taking place in hospitals.
Vincent, are you planning on continuing those universal precautions post-pandemic?
Oh, definitely, yeah. We are. I had a recent visit from the state auditor, surveyor, random, which is to be expected. And I walked in and he was already there, and my first response was like, the breath, like, oh, the state's here. Here we are, right? And I was happy to see that he was 100% like with what sometimes a lot of the providers aren't in queue, aren't in line with what the state requirements are. So as soon as you walk in our front doors at our places of business, like you have to sign the NDAs, you have to sign in, you have to do the temp logs, it has to be monitored. And as I was walking in, I was watching the staff with him walk away. And they turned to look at me, and I quickly visualized just to see that all the components that were in place, all those universal precautions were done. And then we have the biweekly sterilization companies that come in, and so I was confident when he was there, whatever he was there for, yet to be undiscovered, we were going to be fine. And then going through the conversation, he was in town because we just opened a new place. He was in town seeing another place, so it was an amazing exchange, and it was refreshing and rewarding to like be able to do all these things for so long and still help, minimize some of the negative impacts that COVID has had on so many lives.
Yeah, I think a lot of what we see in public is a lot of places starting to roll back some of the precautions that they put in place to prevent the spread of COVID-19. And I think that, epidemiologically, it doesn't make a lot of sense. People think that we might have COVID season like we've had flu season. We've had flu season every year for the last 100-something years, and it's something that we've all just come to accept. It's more likely than not that the next thing is around the corner. So it's important that the things we've installed, especially the ones that have proven to be effective, stay in place, and we continue to install things that will protect the people that are either immunocompromised or not. Preventing infection saves lives. So.
Well, and if we can do those precautions in more daily ways that are not a response to a crisis, then we can, like you said, prevent it. And I just think, some of the most significant impacts of the pandemic, obviously, in addition to like all of the lives lost and the folks who are in a struggle with long COVID, is like obviously the economy like screeched to a halt, and like kids in schools really suffered, and they're continuing to suffer. And obviously teachers are in the middle of a crisis too. So there are these like things about our everyday operations that like can't handle a crisis like this again. And it's really on us to ensure that we're doing everything we can to prevent it becoming like a full-blown pandemic again. And I think these protocols and measures, they may be slightly irritating or inconvenient, but they're just smart, and then they can keep people in schools and in work and thriving and connected to things that matter to them, and all of the things that prevent people from having mental health crises.
I completely agree. As you were saying that, I was seeing like all the fun social things that we like to do disappearing, and we got to find a happy medium. We got to find a balance and some routines and protocols that we can all get on board with that hopefully don't interfere with the things we love to do. Like this conference, how great is this, right? Like, been many, many years since we've been able to get together like this, so thank you again to Health 2.0 for this. So as in the coming years and months, what do you see as some challenges that may be affecting these communities that you work with, where we can find ways to maybe mitigate the impact that this last pandemic had? How can we anticipate what's coming next and make it hurt less? Mark, we'll start with you. Sorry.
I mean, the second question feels different than the first, but I think the most important thing is connection, and I think that's the thing that suffered the most. I think during the pandemic, obviously, like I said, the physical health piece is huge, and it's become the primary focus, but mental health is health, and I think that it's really, really easy to sideline our mental health. We do that, I think, fairly naturally, right? With our workaholism or whatever else, like we're always sort of taking care of ourselves last, and I think what we're seeing now is that mental health and physical health are really connected, and we can't only take care of one. And one of the most important things to combat eating disorders and substance use and suicidality is connection. It's in many ways the best antidote that we have. And so thankfully we live in this digital world where we can have some semblance of connection, but I think we need to make sure that it's meaningful, that it's rooted in our values, that we're able to find people who build us up, right? With the digitalization of the world, there's also like bullies in the comment section, and like a lot of terrible things happen on the internet too. And so how do we create really safe places for some of these kind of new ways that we've found to connect? And in terms of how to make it hurt less, I mean, I think that being connected to people and knowing that you're not going to lose community just because you're not in the same building with someone, it really goes a long way to bolstering hope and to knowing that we're going to get through it. I think the thing that has been the hardest for me, honestly, during the pandemic is this sort of nebulous gray area. When will it end? What will the end even mean? Is there any end for immunocompromised and disabled folks? Kind of not, And so it's like, this lack of like, okay, that is now over, there's no closure. That without that, I think people who are prone to anxiety or struggling with that really need something to anchor them. And I think other people are really helpful for that. So I think trying to find ways to stay connected is going to be really important for not only our healing from this pandemic, but for preventing the like catastrophe of the next one.
Absolutely.
Thank you. I'd like to add on to that just a little bit. I think for the substance use disorder and mental health space, where there's truly a large portion of the people we serve with pure dual diagnosis really suffer from attachment regulation and competency. And so my approach to all people who enter our space is, how do you make someone competent unless they're capable, right? And therefore, so it's not about me. It's not about my staff. It's not about the space. It's about the doorway and that archway. Who enters this space? We look at attachment, regulation, and competency. So we work really hard. In the last 2 years of my study, my data, and has really landed in alliance. Not just the therapeutic alliance, but just like the human nature, like being kind. These simple things like, being service-oriented, that selfless piece that so many of us tend to put last or forget about. And so I have found that just to be the best strategy in the last 2 years. And so I'm really trying to work hard with my staff at our culture of realigning how we're resilient. And so we transfer that into the clients. And so that archway again, so we're demonstrating and modeling what attachment regulation and competency really looks like.
Can I add just one more quick thing? I think grief is a huge theme that we don't often talk about when it comes to the pandemic. We hear these really huge numbers of the number of people who've passed away because of COVID, and obviously there's a certain point at which our brains kind of can't compute those numbers and what that really means, but more and more we all know someone who has died because of COVID-19, and frankly our culture is very bad at dealing with death. We don't talk about it, we have no skills, we have no tools, and so those folks who are more vulnerable in terms of their mental health without any skills to process grief are left then with unprocessed grief that kind of settles in the body in a very damaging way and lingers for a lot longer. So I would really love, in addition to disease prevention and all of the things that we're talking about, I would love our culture to get better at understanding how to talk about and handle losing people.
Absolutely.
Yeah, so I think, there's a lot of factors that have really escalating mental health issues over recent years, even pre-pandemic, but particularly in the pandemic. Lack of social contact, grief issues, long COVID, which I've mentioned, is another factor. Growing rates of Alzheimer's, of dementias. And so the brain needs to really be front and center, I think, as we go forward. We've had huge strides in past decades in cardiovascular care, amazing developments. We've had amazing developments in the area of cancer. And things like colonoscopies now, it's a thing that everybody has at a certain age typically, and prevention is the key. And we don't have these technologies available for our brains. We typically only deal with symptoms when symptoms are already presenting. So I think really we need a change of mindset of how we actually look after our brains, and to get better visibility much earlier in terms of changes that are taking place in different cognitive domains, which will manifest eventually in physical health changes as well. And I think that's an incredibly important area, and that's why I'm really excited to be where I am doing what we're doing with ViewMind.
One thing I want to add to that too, I think it was about 7 years ago, I started bringing martial arts into the recovery space and community, and we started with Kali, which is a Filipino martial art, and it crosses center lines and body movement, different quadrants. And so the cognitive repair and the functioning and that we've seen with those clients, how it's really executed their own personal health and wellness and like arrested the desire to need and just to do something outside of self, like the inner energy. And so I think from like that, one of the earlier speakers was talking about that metacognitive space. I think that there's a lot of body work that's starting to begun, the holistic stuff. And I think one of the things, the barriers that is really happening now for more of the disenfranchised or marginalized communities is what's happening is this, it's almost a malpractice in my opinion, where, you know, a lot of providers are providing like defensive medicine against the payers. And I think it's really poor because things like body movement, yoga, inner energy, martial arts, they don't want to reimburse us for that. And these are specialties, right? And so ASAM says we have to offer these evidence-based practices, which I love. I think they're amazing. But if we're a small place, a small provider, I haven't heard anybody from any Medi-Cal places here at this wonderful conference yet. I'm wondering why. I would love to have some conversation with them. But, you know, for us that are working really hard to cover the whole body, to clean all the rooms and not just the bathroom or the kitchen, you know what I mean, but all the rooms of the self, I think that metacognitive space and doing things to engage people in that arena earlier has been critically important, and it's shown positive results.
And I hate as much as the next guy to turn these people into dollar bills, but we've been dealing with the same issue on our side. Is, you know, I think that there are a lot of stakeholders that aren't involved, primarily the insurance companies, that you know, if people aren't doing the kind of exercises and things that would prevent them from a more expensive and serious health issue, you know, the insurance providers aren't necessarily going in and supporting the individual to engage in those things. And I think, you know, a lot of times we see medical health insurance providers paying out influenza cases, for example. And I think that in my line of work, airplanes play this direct role in hospitalizations related to influenza year over year. And there's a strong correlation between influenza hospitalizations and fatal cases of influenza and the air passenger volume between Thanksgiving and Christmas. So I think that there are kind of these key performance indicators, these key statistics that the insurance companies, I'm not sure why, and if anybody in the audience kind of has a channel of communication that Vincent and I could take advantage of there, please introduce yourselves later on today. But yeah, I think we have a couple more minutes here. I'd like to give each panelist a chance to say a parting last word, and then if we have a minute or two, I will try to open up the floor to questions from the audience.
Yeah, I'd like just to add, I hope I didn't sound attacking, but sometimes I might sound that way. It's not on purpose. I think there's a lot of money that's starting to move into the government because of COVID, and I think it's wonderful. I would hope to see more accountability there because, you know, again, working with a large, you know, a lot of, you know, ethnical and marginalized communities, people of color, LGBTQ+. These people come in, they need services, they have no money, they say the money's there, but we can't find the services. And for me, that's very frustrating. You know, 60% of our clients fall into a hardship category.
Right.
And so, you know, when you're in business for 2 years and you don't make $1, like, it's very frustrating. So chasing the money is difficult. And so I want to be part of that greater conversation where, you know, that's outside of this health net, you know what I mean? State, with the, you know, the feds, about where that money's going, how it's there, and where we get it to. And so that's what I was trying to hone in on. I hope I didn't miss that part.
Yeah, we want to make sure we're enabling the people that can make a difference.
I just want to say thank you to each person on this panel for the unique ways that you're helping the people. Like, I thank you for making Plains feel like a place that I can go, because I'm going on 8 trips in the next 3 months, and I'm very grateful that I feel safe to fly. And thank you for your work with brain imaging, and thinking about prevention is such a huge deal to me. And eating disorders, I think, are like 67% genetic at this point. And so thinking about finding ways to identify these people before they struggle and are in crisis and need to be hospitalized is amazing. And thank you for what you're doing with substance use and detox and inpatient. That's extremely difficult work. And I love that you're bringing this like authenticity. And I can tell that you bring like a playfulness and a realness that makes them trust you. And I just feel like very grateful that all of the people that are talking about these vulnerable populations like really seem to care about the people that we're talking about and are doing really good work. So thank you.
Likewise, Rebecca.
Thank you.
Thank you.
I'll just thank everybody as well. Thanks to the panelists and moderator, thank you. And I look forward to any questions.
Yeah, why don't we have some audience members coming up?
I don't mind smart remarks either. Those are actually my favorite. Questions, comments, or smart remarks? Anyone?
You hear me now? Okay. Well, thank you for being a panelist. My name is Wayne Chen. I'm a medical director for a health plan, so I'll take some of these hits here. And in my role, I actually work with our employer groups with high-cost claimants. And invariably, I'll see high-cost claimants with eating disorders, substance use dependency disorders, strokes, not so much dementia, but you're kind of up there, right? And to me, I think there needs to be more innovation in this space, right? And so I'm very happy to be affiliated with Wound Masters because they actually go to the home to provide wound care for homebound Medicare seniors. And so my question to you all is, what do you think the current state is and the opportunities for digital therapeutics for eating disorders and substance use dependency and, dementia? Thank you.
Well, there have been a couple, thank you so much for this question, and I want to talk to you later. But there are a lot of really exciting innovations in the eating disorder space, and what we've found is that there actually are treatable virtually, and so there are a couple of really phenomenal companies. Equip is one of them that was founded by actually the same founder as my nonprofit, so the biggest issues is how homogenous the provider spaces and how few people are trained to treat eating disorders at all. It's just not required in medical or mental health programs, and so it's like a niche specialty, which does not work when at least 30 million Americans have eating disorders, right? We need way more than 5,000 eating disorder providers in this country. So I'd like to stay innovative, and I'd also like to increase the volume and diversity of eating disorder providers.
Thank you.
Yeah, thank you for the question. I think it's great. It's also a difficult question because so many people who suffer with, let's wind back what substance use looks like. It starts with fun with problems and problems, use, abuse, and dependency. And most people that end up with that place where it's just problems and dependency didn't decide when they started hey, it's going to be fun that I want to end up homeless, or I want to lose my family, my jobs, I want to lose life, I want to lose limb, I want to go in and out of institutions to the point where, I'm hopefully in this moment begging for help. And in that small window of help comes, I want my face to be there. And so creating some digital space or some new, way to attract people to that is very difficult. It's very difficult because it's not really profit-driven. So it has to come from a humanitarian space. And I think the humanitarian, like this young lady was saying, the answer is connectivity. I use the term alliance because I want to align myself with those people wherever they're at. And sometimes that means going down to Skid Row. Sometimes that means when I'm getting my truck and I'm filling my truck with gas, it's overpriced, and I see the guy washing his hair at the water thing, I go and I have a conversation with him. And I don't know how to get people to do that. If I did, I think the problem in the 100,000 deaths we're having this year alone from, overdose, and not just overdose, but poisoning would be reduced. And so I would love for people to tell me, because then I would utilize it.
Thank you.
Yeah, so I think sort of looking at your question in sort of two parts. Firstly, in terms of digital technologies, digital health. It is going to have a huge impact on the healthcare sector for many, many different reasons. One of the reasons is that you can gather data continuously. So you can, maybe in the past, if somebody would go to a doctor's, they would get their blood pressure checked, they would get their pulse measured. I mean, now you can be monitoring it all the time. Mine's being monitored all the time. I've got a watch, and I'm sure many people here have watches that are monitoring various different vital signs. So you can take information from that data that you just couldn't take by just doing a sort of a ad hoc test every now and again. In the case of ViewMind, we have by looking at these eye movements that, obviously the eye anatomically is part of the brain, in the span of 15 minutes, which is, let's say, a battery of a number of different tests, we're gathering 100,000 data points, which we're analyzing with AI. I mean, and the eye is moving hundreds of times a second. So we're getting unique information that you wouldn't be able to access otherwise. In terms of digital therapeutic, which is the sort of the second part of your question, I can give you, one example. So we're working with a professional athletic team, and there are some of the players have concussions, and we're able to see with our analysis of their cognitive domains the specific aspects of cognition that have been impaired as a result of their concussion. We've presented them a training exercise using our digital technology, which is activating different brain areas. And these individuals had a concussion for 2 or 3 months. The impairment stayed pretty much the same. Within 3 weeks of being exposed to our training exercises, they substantially recovered those impairments. So that's an example of just the kind of impact that this sort of technology can have.
Great. And thank you. If I could just provide one kind of PSA, there's a company called Altais, A-L-T-A-I-S. They're an innovator in healthcare looking transform care, and they're looking for partnerships as well. So I don't work for them, but if you're interested,
That's great.
They're out there. Thank you. Thank you.
I think we have one more question that we can try to get through quick. And just for the record, virtual meetings are much better for infection prevention, but I am anti-virtual Thanksgivings.
So I don't have a question, but I have a thank you. So tomorrow I'm giving a talk on the societal impact of undiagnosed and untreated mental illness. And so I'm happy, and one of my slides says, mental health is health. And so I'm grateful to the Healthcare 2.0 because in fact I've heard that saying a number of times. I'm not sure I'm worried about what aspect of mental health is health, but I would like that to be an ongoing platform. Mental health is health. And we spend so much time on thinking about physical health, but really how much time can we spend in the future and now going? And if I have to thank one thing for the pandemic, and I don't thank it for much, it would be bringing this to the fore, including telehealth. So thank you for that.
Thank you. I can't wait for your session.
Thank you.
All right. I think that completes our panel today. Thank you all for being here. Let's try to keep these vulnerable populations safer by preventing more infections and hopefully save more lives, keeping up some of the important things that we installed during the pandemic that hopefully we never have to do something like that again.
Thank you.